Hello, friends. So today we are going to talk about hierarchy of evidence. Now, is this really important? And the reason why I'm asking this is because I've always heard this that it's we have to always look for systematic reviews because that is right at the top of the hierarchy. So that counts more than any other studies. So to be honest with you, that is actually not the case. Every study has its value, has its importance. Uh, I think the key is that the hierarchy is useful when you are trying to answer a question and you're doing a literature review. So, for example, you are in your clinical practice and you want to try and find a question to a clinical scenario uh, which you are struggling to find an answer to, and then you are reading upon evidence. So then I think it would be useful that when you do your search, you start with the systematic review and the hierarchy. But again, it also depends on the question. So say if you're looking for a particular medicine, then I think a systematic review of meta-analysis is relevant, and I think that counts more. But every study has its own importance, and I think we should not take any study lightly for that matter. Now, if you look at the hierarchy, so level one is systematic reviews with meta-analysis, where a randomized control trial, where they've included all the data of the randomized control trial. So yes, when you're searching a particular article, I think you can prioritize the systematic reviews with RCT and meta-analysis. Yes. Uh, Level two is a well designed randomized control trial. Yes, understandable because uh, you are comparing a particular idea with the control group. So again, and then if it is a well defined randomized control trial, whether it is double blind, I think that counts even more. Level three is control trial without randomization. Now, again, although it is at level three, but sometimes I think this is important and relevant. Why? Because there could be times where you can't keep the study blinded in a way, and it could be an open label study where the participant knows what medication or what is it that they are taking. And this especially is relevant when you're looking at very rare condition and you're trying to treat a very rare condition. So maybe at this point in time, it is difficult and not practical enough to do a double blind or even a single blind randomized control trial. So that could potentially be an open label study. I think the key is it doesn't matter whether it is a control trial with or without randomization. I think the key is other aspects of research, whether you've tried to reduce any sort of bias, whether it is selection bias, information bias, outcome bias, whatever. So I think it's important to reduce the bias rather than thinking of randomization or something, because sometimes if the condition is rare, you may not even get a proper sample size. So I think it's important that you try to reduce the bias as much as possible. If you think of level four, again, if you think of case control studies and cohort studies, whether it is a retrospective or a prospective cohort study, they are very useful as well. And I think in level four, it is also cross sectional studies. So if you want to compare, so say a cross section study is that you are trying to compare amongst different groups about a particular condition or medicine or risk or cause. So again, it is by no means less in a way, because uh, if it's a very rare condition and you're trying to find a risk factor, then case control study helps. Retrospective case control studies, you're going backwards and then you're coming to present. So I think it's important that that is acknowledged as well. And then there are rare conditions where you're trying to find the cause or risk factor. I think case control studies or cohort studies is very, very important. And cross-sectional study also has its place where you're trying to establish that whether this particular, say for example, treatment is appropriate in a particular setting. So you're comparing. Just to give you a random example, what would be an ideal environment for mental health treatment, whether it is at home or in a community setting or an inpatient setting, and you're comparing different settings there. So you're collecting data from 3 different settings and you're comparing it. So again, that could be a very good cross-sectional study. So again, I'm reiterating here that every study has its importance. So although there are levels, but I think this levels of hierarchy is more relevant when you're trying to search, when you're doing your literature search. That is where its importance is. Now, if you look at level 5, systematic reviews of descriptive, so that means a descriptive systematic analysis where you've not done any sort of statistical analysis, you've not done any meta-analysis. However, it is still important. You are describing the data you have collected from past evidence, and then you're doing a thorough review of that. So it's a very descriptive analysis. So again, that is by no means less. Sometimes we don't have enough resources where you can, we don't have enough training or skills on doing statistical analysis. So you're more comfortable doing descriptive. So I think that is by no means less, as long as you've done a thorough descriptive analysis of the studies you've included. For example, review articles. So like if you're doing a thorough literature search and you're gathering all the evidence, analyzing it very well, then that is also recognized equally. And then if you look at the level 5, they've also mentioned qualitative studies. Now, qualitative study has its role, a very important role, where sometimes in quantitative data, you may only get a yes or no answer, or you get a particular number there. But when it comes to qualitative study, it's a free flow type of study where you are describing everything in detail, and then you're picking up some common themes. So that in itself has a very important role. So say you're trying to understand the awareness, you're trying to understand the potential cause of. So say for example, you want to assess stigma. Now again, you can't assess that based on a yes or no. I think if there is a particular stigma around something which you may think that no, I think this shouldn't be stigmatized. I think this should be talked about. This should be discussed openly. And that is where the role of qualitative study is, that you are trying to identify the reason that why is this particular thing stigmatized. And then you're doing your interviews, you're doing your one-to-one interviews, or you're doing group or focus groups. And then you're trying to get to the bottom of that, and that's where you're doing a descriptive analysis. And then when you talk about it, and then you try and document all that description which you've received from the participants, that gives you a lot of idea, because you're picking common themes. So say you've collected, you've interviewed 10 participants, and then you've taken very detailed notes. Either you've handwritten it or you've recorded those, obviously after taking consent. And then you're analyzing it, that, okay, so there could be a case where all 10 participants have voiced similar concerns. So you're picking common themes from there. So again, that is something which you may not be able to find in a quantitative study, like in a randomized controlled trial or any other clinical trial for that matter. So that is where the qualitative study is equally important. And then, the level 7 is the opinion and case reports and all. Again, I'm not saying that that is something which is of lesser value or importance. I think there could be some case reports where where they've identified a very rare risk factor and cause relationship, and that is something which they want to highlight, or they want to a case study has been published where they've used an off-license medication to treat a particular condition. So again, that is something which needs to be highlighted. And so again, it's about what exactly this case study is trying to identify, and if it is relevant, if it is novel, then that can be recognized as well, especially in if you're trying to understand about a rare condition or a rare disease, or you're trying to find a causal relationship. Then again, this also counts as well. So overall, if you think of the hierarchy of evidence, every study has its role and it has to be equally recognized. However, when you're doing a particular literature search, when you're doing a review article, and if you feel that there are studies, being a particular study where it is quite relatively common, but one study you found where it was a double-blind randomized, and the other study was open label trial, then obviously you would prefer to include the double-blind randomized control trial over the open label study. So again, it's about prioritizing it, and it's about trying to answer the research question you have. If you're doing a literature search, I think the hierarchy of evidence is valuable, but if you want to do a particular study or a clinical trial, then the choice of research methodology should not be based on the hierarchy of evidence. The choice of research methodology depends on your research hypothesis, right? So that's it from my side for now. Thank you very much for your time, and I'll see you again in my future videos. Take care. Bye-bye.